Dr. Chris Allison,
Okay, and how do I spell your last name?
Allison,
Perfect.
Port Arthur Health Center.
Awesome. Can you tell us a little bit about this new initiative?
This new initiative is one of the best things I think that has happened at the Port Arthur Health Center in the recent past. The team approach to care of patients is, I think, the way to go. The way funding works with our clinic means that we did not have access to these services directly, but with the new initiative, we have 3 people in the clinic, I believe, at all times, and then access to foot care through here. So it'll be a great advantage to our patients.
And what kind of services does this initiative entail?
There is counseling, which can be done on a very quick basis rather than going through the usual route, which can sometimes take some time. There's foot care, which is really important for diabetes. There's dietary services, which again, especially for diabetes, but also for obesity and other conditions. And then there's, I think one of the most important things is system navigator. And they are people who help patients get through the various services that are available, how to access them, help with transportation, for instance, to get to appointments, that kind of thing.
And what are some of the barriers patients face while reaching out for health care?
I think one of the most important things that this initiative will do is that it is in-house. So in my office, I can walk up the corridor and I can say, look, we have a problem here. Can we help deal with it? And it's fast. Before this, it was a matter of, I'll make the referral goes out. When it comes back to the patient or how it gets back there, I don't know. This way, I've got really ready access.
How did this partnership come together? I mean,
I believe the LIN suggested it. Norwest took it over, and they are the party who is organizing it. So they came to the 3 clinics who are, as I said before, were funded differently. So access to the type of care that they provide is not readily available to our patients. It is available, but in different areas of the community. So this brings it all in-house.
Can you talk about the impact then it's going to have on patients? What is this actually, long run? What is it going to mean to the community?
It can only be good for the patients. Just the fact that the services are there, but also readily available and in-house, I think, is the most important thing. The services are all out there, but accessing them can be very, very difficult for especially disadvantaged people with issues with transportation, trying to get around the city, that type of thing. But to be able to walk up from my office up to another office and see someone in a very timely fashion, I think that's the big advantage.
And what are some next steps for this initiative? Are there any other plans that you are planning to do in the next couple of weeks and months?
Not that I know of. I think this has just started, a few months ago. I've used it a fair bit myself, and so have the other physicians at the clinic. And I'm sure the other 2 clinics who are involved have been using it as well. As far as the future is concerned, I really don't know. I would hope that it will expand. The team approach, as I said, to the care of our patients is of paramount importance.
Perfect. Awesome. Thank you.